Hi, I'm Dr. Omar Ibrahimi. I'm a board-certified dermatologist that has expertise in laser and aesthetic procedures. One of the procedures that we have recently launched is something called Ellacor. We're actually the third site in the country and worldwide to have this technology. So we've been getting a lot of questions online from people just asking exactly what this is, how it works. There's a lot of misconceptions. Some people seem to think this is microneedling, and other people think it's an extremely uncomfortable procedure. So I just wanted to make a short video just to kind of clarify exactly what Ellacor is, how it works, and share some of the early clinical results that we've been getting with our patients. It's indicated for the treatment of moderate to severe wrinkles of the lower face, including the cheeks and the perioral area. It was actually developed at Harvard Medical School and Massachusetts General Hospital by a dermatologist, Dr. Rox Anderson, and a plastic surgeon, Dr. Jay Austin. For those of you that don't know, Dr. Anderson has been behind many of the advances in cosmetic dermatology, things such as Fraxel, cool sculpting, laser hair removal, laser tattoo removal, and the laser treatment of red and brown spots. And so this is just the latest in his innovations. The way Ellacor works is it actually removes thousands of micron-sized cylinders of skin in a treatment session. And so these holes kind of close up in real time and actually tighten the skin around it. And when you take out thousands and thousands of pores, you could get a substantial improvement in the appearance of wrinkles and loose skin on the lower face. This is a totally unique mechanism of action. There's nothing like it on the market today. A lot of people have said, well, isn't this just microneedling? No, microneedling is actually completely different. Microneedling uses an array of needles that penetrate into the skin, but do not remove any tissue. You can also combine microneedling with RF energy, which is also a very popular modality. And in this, the microneedles go into the skin and then deliver a little bit of RF energy, which thermally will damage the tissue. But again, no tissue is removed with RF microneedling either. How does tissue microcoring differ from things like laser? That's also a question that I get commonly. The difference between tissue microcoring, where we're removing little cores, tiny cores and cylinders of tissue, is that there's no heat or thermal damage of the skin, okay? So something like a fractional ablative laser, where you're actually ablating or creating a channel of vaporized tissue, also comes with a coating of heat damage to the tissue. And it's thought that this coating of heat damage actually is what prevents the hole from closing up. And in tissue microcoring, you don't actually have that heat damage. And so it's thought that the hole can close easier and bring about an improvement in the laxity of the tissue. So with tissue microcoring, the thought process is when you see a plastic surgeon and they cut out skin, they typically will take it out from in front of the ears and onto the neck and take out a large portion of skin and then pull the loose skin tight. Now, instead of taking out a large amount of skin, what Ellacor does is it takes out thousands of little tiny cylinders of skin. And when you add the amount of tissue that's removed, it's not all that different than what's taken out during a facelift. However, because these tissue cores are so small and tiny, they don't trigger a scarring response. So these holes will actually close up without any clinical evidence of scarring. And when you take out large amounts of tissue, you can actually get tightening in a minimally invasive way. The other main limitation with a face or neck lift is while you can pull lax skin tight, it does nothing for the wrinkles around the mouth and the perioral area. And this is one of the applications of Ellacor that I'm so excited about. And I will share some of my before and afters of my earliest patients to show how this point really hits home. Also getting a lot of questions on who's a good candidate for treatment. So this is a great question. I think the ideal candidate for Ellacor is going to be patients that are in their mid-40s all the way to their mid-60s where they're developing a slight amount of tissue laxity and lines here. And these are really great patients because the modalities that we have available today are not really suited to addressing their kind of concern. So something like a facelift or neck lift is probably going to be just too drastic of a procedure, and it's a surgical procedure which requires sedation and may be too risky for what many of these patients are willing to undergo. Likewise, the non-invasive options that we have are just really underwhelming in terms of bringing about meaningful clinical improvement to this. So in summary, I think the ideal candidate is going to be somebody that is developing a little bit of tissue laxity, lines on the lower cheek, lines around the mouth. They're not quite a surgical candidate, or they don't want to undergo surgery. And these are going to be the kind of candidates that I think are going to be in the sweet spot for treatment with Ellacor. So how do I go about evaluating somebody for Ellacor, and what kind of expectations do we set? This is really important. It's key to make sure you're meeting with the physician that is going to spend a little time and explain to you what is reasonable to expect in terms of outcomes and downtime and healing. And I tell people Ellacor truly is a procedure. Even though it's minimally invasive, I don't liken it to a treatment where you're just coming in and out. The pre-operative evaluation is key. You want to make sure that you understand and patients understand that this is not a replacement for a facelift. This is not going to put a good plastic surgeon out of business. This is really for patients that have some amount of laxity, which doesn't rise to the occasion of needing a face or neck lift, but there is some early laxity, there is some wrinkles, there is some aging or wrinkles or rhytids around the perioral area that bother the patient. Next, I kind of make sure they understand what the downtime is going to entail and what the procedure is going to entail. And so basically, when somebody comes in for a treatment, we make sure we take photography, we bring them in, we place numbing cream on their lower cheeks and perioral area. Prior to the procedure, we have them remove all the numbing cream, and then I supplement that numbing with some injectional numbing medicine, lidocaine, which just makes the procedure really comfortable. This is really key because in my experience, most of the patients with my numbing medicine approach rate the pain as mild. And there's been a lot of comments when people see this device or treatment, oh, the treatment must be really painful, or that doesn't look comfortable. Actually, I've been really impressed, and most of the patients that have done this have not described pain as being a significant barrier or something that they really found to be troublesome. So most of the people have noted that the pain was very mild with this treatment. When it comes to recovery, obviously we're removing thousands of cores of tissue, so you can actually see little tiny holes in the skin. And these close up over hours to days. And so obviously there is going to be a little bit of downtime with this. In my experience, this can range anywhere from 3 to 4 days to about 7 days. So just being conservative, I tell patients to plan on about a week of downtime. We are actually looking at ways and post-procedure care that can shorten the downtime significantly to get this to be under a week. And I think we're going to have some improvements in the post-procedure care coming out quite soon. But generally speaking, it's just very basic care, gentle cleaning with soap and water, and then application of post-procedural topicals such as Aquaphor or Vaseline. In terms of expectations, it's important to note that most patients This is not going to be a one and done type of treatment. It's typically going to take somewhere between 2 to 3 treatments for most patients to get a meaningful improvement. The treatments can be done as soon as about a month apart, depending on what the patient has going on in terms of social downtime, etc. I want to share some of my clinical results with you. So this is a patient of mine. She's 62 years old. You can see she's got a good amount of sun damage and photo aging. And you can see this is before and after just a single treatment. She's 90 days out. So none of these improvements are from swelling or post-procedural aspects. This is 90 days or 3 months out. And if you look at her, you can actually, if you looked at the photo, you would actually think that I did some sort of filler on her. So you definitely see an improvement to the nasolabial folds and the melolabial folds or the marionette lines as we talk. But look also kind of around the mouth in this perioral area. And what you can really see is there's a nice smoothing of the skin. And this is really difficult to do with filler. It's sometimes hard to get a nice even smoothing, or to even take some of these marionette lines, which can be really, really deep, and it can take a ton of filler product to get it to kind of come up and over. And so I was really impressed with this result after just a single treatment. However, I do, tell patients that oftentimes they have to plan on more than one treatment to get an improvement, but it's nice to see this kind of improvement with just a single treatment. This next patient of mine is a 58-year-old woman of Italian-American heritage. And this is after 2 treatments. And she is 3 months out after her first treatment and 2 months out after her second treatment. And again, you can see a dramatic effect. Almost looks like I placed a filler in her nasolabial or smile lines and her marionette lines. Again, aside from that, you can see a nice overall smoothing effect in the perioral area. And then if you actually look, you can actually see some improvement in kind of the jowling as well. One of the other really interesting things that I'm observing in my Ellacor patients is that aside from this filler-like effect, they're all commenting about how their skin feels better, looks better. And so there's a third thing that I'm observing, which is really, really interesting, is what happens over time with the aging process is that we develop laxity and things start hanging down. And that's where we get jowling and we're losing the bony structure and support of our skin. And so traditionally, the way we've gone after this is to do injectable fillers to blow that balloon back up or provide more structural support. I think Ellacor is going to be really game-changing because this is a way to take out tissue or remove tissue. And so instead of blowing air into the balloon to tighten it up, we're actually kind of shrinking the wrap or the skin around the bone. And this is really the first non-invasive or minimally invasive option to do this short of surgery. But if you actually kind of stand back and look at these patients, you see that upside down triangle of youth kind of being restored, where the lower face becomes kind of narrow and the jowls kind of tighten out. So again, this is really encouraging. And what I love about this is the results are really natural. It's not changing the way any of my particular patients look. They're still them, but just a previously restored version of how they looked. Finally, I'd like to share with you another patient of mine. This is probably one of the most impressive results I've seen with this technology since it's been launched commercially. And this is a 57-year-old patient of mine who does everything to take care of herself, from working out, dieting, does all kinds of procedures. And she's always been unhappy with the way her lower face looks. And we've tried injectable fillers, everything ranging from hyaluronic acid fillers to polyl lactic acid or Sculptra. but she's just never been quite happy with the way her lower face looks. And this here is a before and after of 2 treatments. So she's 2 months out from her second treatment and 3 months out from her first treatment. And again, just a really obvious improvement. Again, almost looks like I did filler. Improvement in the nasolabial folds, the marionette lines. Look at the smoothing in the perioral area where the lines are kind of flattening and being smoothed out. This is really, really hard to do with injectable filler. If you actually kind of look at the photo closely, I'm actually seeing a little bit of a lip lift also. So removing the tissue around here is giving us more show of the pink of her lips. And so may this technology help kind of give us a little bit of a lip flip or lip aversion or a greater show of the lips. I think that's definitely something that's possible and something that we need to look at more rigorously. But, you know, again, just a really exciting and cool result that we've seen. So in conclusion, Ellacor is a technology I'm really excited about. This is an entirely new mechanism of action with the removal of thousands of little tiny cylinders of skin that heal up without any evidence of scarring. As I mentioned, we're an early launch site for Ellacor with the company, and so I'm really excited to see the direction that this goes in. Patient satisfaction has been really high thus far. Pain with the procedure has been mild and very manageable. No one describes it as insurmountable. And we've done this procedure on experienced cosmetic patients, patients that haven't done many procedures that are coming in and this is their primary concern. And so it's been really manageable. And I think this is one of the really important points to make. So I'm probably being a little redundant, especially just because the procedure may look like it might be uncomfortable, but pain really hasn't been an issue with my patients. Again, the post-procedure care is pretty easy and straightforward, and satisfaction has been fairly high. So thank you so much for tuning in to this video, and I look forward to seeing where this technology goes. I think there's many applications that we have not begun to investigate yet that are also going to be coming out based on this technology. So stay tuned. Take care.